Ecstasy, a common street drug that is also referred to as Adam, the love drug, M, or candy, is a stimulant that can be ingested, snorted, or injected, causing a euphoric high that lasts up to 3 to 6 hours. But before we dive into the effects on humans, we have to discuss its active chemical ingredient, MDMA. Following the discovery of amphetamines a century ago, drug companies were eager to create other variants of these stimulants and explore their effects. A new drug, MDMA, or methylene dioxymethamphetamine, was thought to have potential as an appetite suppressant, although animal tests proved otherwise. MDMA was all but forgotten until 1953 when the U.S. Army Office began to explore psychoactive drugs as a non-conventional agent for use in warfare and interrogation. In 1965, a biochemist working at the Dow Chemical Company, Alexander T. Shulgin, synthesized MDMA. In 1978, Shulgin published the first scientific article on the effects of MDMA on humans, noting that the drug caused people to open up socially and turn timid users into highly social talkers. It seemed to reverse any social deficiency. MDMA, he said, could do all things to all people. At low doses of 40 to 80 milligrams, you feel heightened interpersonal feelings toward others, high self-esteem and confidence, general state of euphoria, intensified senses of touch and taste, intensified colors, and a feeling of personal insight into oneself. At a higher dose of 100 to 120 milligrams, users may feel panic, depression, confusion, or anxiety, which is often followed by the crash.
Ecstasy causes long-term brain damages to areas involving thought and memory. The nerve cells that are damaged by ecstasy use serotonin to communicate with other neurons. In an experiment done at the Johns Hopkins University on red squirrel monkeys, researchers found that 4 days of exposure twice a day to ecstasy caused damage that lasted for 6 to 7 years. The areas most affected by ecstasy were the neocortex, which is where conscious thought occurs, and the hippocampus, which is responsible for the formation of long-term memories. People who take ecstasy even just a few times are at risk for permanent problems with learning and visual and verbal memory. Some brain recovery is possible, but the damage is often permanent due to the extensive reductions in the number of serotonin transporters.
Ecstasy's physical effects on the body include liver failure, heat stroke, tooth and gum damage, heart failure, and increased risk of unsafe sex. Some physical signs of overdose include fever, rapid or irregular heartbeat, shallow breathing, high blood pressure, dilated pupils, blurred vision, dry mouth, profuse sweating, teeth grinding, tremors, seizure, stroke, coma, and it can also lead to death.
According to a survey conducted on Erowid.org in 2004, about 25% of ecstasy users range from ages 13 to 17, about 38% of users range from ages 18 to 21, about 22% of users range from ages 22 through 25, and the remaining users were over the age of 25. When asked if monthly ecstasy use can lead to problems, 32% of users claimed that it might lead to some problems, while about 26% said it was unlikely.
While few studies have tested the dependency among ecstasy users in the general population, it is known that ecstasy affects many of the same neurotransmitter systems in the brain that are targeted by other addictive drugs. Users have reported symptoms such as continued use of the drug, despite knowledge of its negative effects, tolerance, and withdrawal effects. For those who suffer from ecstasy addiction, there is treatment available. There are no drug treatments for this addiction, so cognitive behavioral therapy is the most common treatment. Cognitive behavioral therapy is helpful in managing the psychological effects of the drug after detoxification.
If you or someone you know is suffering from an ecstasy addiction, you can start by calling the 24-hour hotline at 1-855-407-9909.